Hi, my name is Jessica Newman. I am a nonprofit professional here in Boston doing fundraising for a theater nonprofit called Arts Emerson. I'll actually be leaving that job at the end of this week to pursue my MBA at the Yale School of Management. So I was facing numerous dental health issues. I had a receding gum line, particularly on my bottom teeth, and that was a result of both genetics. My mom had a similar issue and actually went through Dr. Dayan's procedure with AlloDerm throughout her whole mouth. So there was that genetic component to my recession, but also some other issues contributing to it regarding my tongue, where my tongue was actually pushing out my bottom teeth because it wasn't in the right spot on the roof of my mouth, and that was resulting in the increase in recession on those bottom teeth, as well as mouth breathing. I was not keeping my mouth closed and breathing out of my nose as I should have been, which also was drying out my gums and continuing to perpetuate that gum line recession. So because of those issues, Dr. Dayan directed me to Joy Mueller, who is a myofunctional therapist. And with Joy's help, I was able to correct a lot of those issues, particularly relating to my tongue and my mouth breathing. So Joy has numerous fun exercises she asks us to do with buttons and wooden blocks and rubber tubes. They're almost like games that you do that kind of train your mouth to be in the right position. So now, for example, my tongue automatically goes to the roof of my mouth in its natural resting position rather than to my bottom teeth. My lips stay naturally closed during the day, so I'm no longer breathing out of my mouth, but rather breathing out of my nose. And overall, my mouth is just stronger, and that's contributed to improved gum health, which has allowed me to, hopefully, once it's safe to do so given COVID, eventually have this surgery with Dr. Dayan. And as I mentioned before, there was also this genetic component to my gum line recession. My mother also had this recession, and she had her whole mouth done by Dr. Dayan. And she tells me constantly how painless the procedure was and how much it has improved her life to have healthy gums and know that as a result, her teeth are safe and stable. And she is adamant that when I have my surgery, I can't go to anyone other than Dr. Dayan. So again, once it is safe to do so, my plan will be to make a trip out to LA, visit Dr. Dayan, and have this procedure done now that with Joy Muller's help with myofunctional therapy, and also just with increased dental visits, softer brushing, better use of mouthwash and water picks, now making my gums healthier, will allow me to go and have that surgery. So I recommend Dr. Dayan wholeheartely. Not that I've had the surgery yet, but given my mom's experience, it sounds like it will be a easy and painless and helpful procedure. But I recommend her wholeheartedly for her interpersonal abilities. You know, when I discovered I had all these dental issues, Dr. Dayan was one of the most supportive people I could have possibly asked for. She called me, she walked me through what my next steps were to start improving gum health so I would be ready for the surgery. She got me connected to a dentist in my area who I absolutely love. She got me connected to Joy Mueller to do the myofunctional therapy, and then she continued to check in periodically throughout the past year as I've been undertaking those changes and procedures in my life. So the fact that she's so present and committed to following up with her patients and making sure that they're doing well, and that shows she really does care about you on a personal level. And given that gum health can be a pretty personal thing, and to have a doctor like Dr. Dayan in your corner, advocating for you, caring about you, is just something that is irreplaceable, and I'm very grateful for. And I look forward to meeting her in LA once it is finally safe to do so.